Hi, my name is Jessica Booslog, and I'm going to be doing a Foley catheter skill today. I'm in my Nightingale scrubs with my name badge attached. I did hand hygiene. I knocked and asked if I could enter. When I did enter the room with permission, I brought my supplies, which are a Foley catheter kit, 2 washcloths, and gloves. I'm going to do hand hygiene again, and I'm going to introduce myself. Hello, Patty. My name is Jessica. I'm your nurse today. Can I just look at your wristband and confirm your ID? It says Patty Jones, and your date of birth is 8/18/73. Is that correct? Okay, great. I'm going to put my gloves on, and I'm going to explain the procedure to you. Patty, we're doing a Foley catheter on you today. Your doctor ordered this because of some urinary issues you've been experiencing lately. Is that okay with you? If we go ahead and do that? Okay, great. The good news is your bed is at the perfect level for me. It's right at my waist, and you're already in a completely flat position in your bed. So I'm gonna pull your nightgown up and over. I'm gonna ask you to raise your knees up and then spread open. Thank you so much. You're gonna feel my hand on you. My hand is now on her pubis, spreading open the labia. I'm getting a clean washcloth and using no rinse foam soap. I've got a clean corner, and on the labia furthest from me, I'm gonna wipe from top to bottom. I'm gonna get a new clean corner on the labia closest to me, top to bottom. And then I got a new clean corner, and I'm going to get the center in between the labia, top to bottom. I'm gonna put this in my biohazard trash can. While I did that, I did assess for any odor or discharge. I did not see anything, and I identified the urinary meatus. I have another washcloth. It's dry and clean. I'm going to pat you dry in the same fashion, Patty. I'm going to go ahead with the labia furthest from me, patting dry from top to bottom. I have a new clean corner, and I'm going to pat you dry on the labia closest to me, top to bottom. And then I have the third clean corner here. Let me make sure that's clean. And go in the center of the labia, top to bottom. I'm gonna put this in the biohazard trash can. I'm gonna remove, bear with me, Patty, thank you so much. I'm gonna remove my gloves by pinching the center, pulling away from my fingers, balling that up, reaching underneath my glove and pulling that over. I'm gonna drop that into the biohazard trash can. I'm going to do hand hygiene again. I'm gonna explain to you, Patty, this is a sterile procedure, so I need you to keep your hands above your waist. Don't touch yourself or any of my sterile supplies. Okay, great, thank you for helping me with that. I have the sterile catheter kit. I'm going to take it out of its package. And we're going to place the bag over to my left. Patty, I'm going to put this kit between your legs, so please be careful not to knock it over. Opening up the folds here. I've got my sterile gloves, and I have plenty of room back here where the wrapper is not going to be touching any of the other materials. I'm opening up my gloves by the 2 folds here, not touching anything, no overlap whatsoever. There's a margin around the wrapper that I'm going to maintain. I'm going to take these fingers here in the cuff and pick up my glove. For my dominant hand, I'm going to put my fingers into this glove and maneuver the glove onto my hand. Keeping that cuff intact. With these 3 fingers, I'm going to pick up the other glove. I'm going to maneuver my fingers into this glove. There we go. I'm going to pick up the paper in the center and discard of it. Okay, Patty, I have a drape that I need to put underneath you. Can you lift your hips for me? I'm gonna pick up the drape, and with the plastic side down, we're going to slide this under your hips. Great job, thank you so much. I have another drape, Patty, that we're going to put on top of you. This drape has not touched anything. Very good. I'm going to get my catheter kit ready here. I'm going to take the tray off. I have opening up my alcohol swabs and place those here for myself. Get rid of that. I've got my lubricant. I'm going to open that up and put a little lubricant here. I'm going to take the syringe and take the lid off. I've got my catheter. I'm going to take the protective sleeve off. I'm going to take the syringe and put it in the port. Securely. Okay. I'm going to put this tip into some lubricant and set it in the tray. I haven't touched Patty yet, but at this point I'm going to start cleaning her, and this is going to be the hand that I use. Okay, Patty, you're going to feel me touching you again. I'm going to hold her open and I'm going to get an alcohol swab. I'm going to clean like I did earlier, the labia furthest from me, top to bottom, discard. I have a new swab, and the labia closest to me, top to bottom. I'm holding it at the end, top to bottom, and discard. I have the last swab, holding it at the end here, and I'm going to clean top to bottom in the center and discard. Okay, Patty, I'm going to need you to take a deep breath. We're going to insert this catheter now. I'm going to hold the catheter 2 to 3 inches from the end, and we're going to insert. Okay, I'm going to insert, I see urine flash, so I'm going to insert another 2 to 3 inches. There we go. I'm going to hold this with this hand here, my left dominant hand, and I'm going to insert 10 mLs of sterile fluid. All 10 mLs are in now. It's okay for me to let go here and pull the syringe out. Sterility is done and the catheter is placed. I'm going to, okay, Patty, I'm going to secure this to your leg with a cath strap, and I'm going to clean up my stuff here. We're going to put your catheter bag on the side, hang it on the side of the bed here. We're going to get this all picked up. I'm going to get your drape off of you. There we go. Do a little peri-care, top to bottom. Lift up your hips and we'll get that drape. And we're discarding of the whole kit in the biohazard trash. I'm going to now remove my gloves by the same method as earlier, holding in the palm and away from my fingers, balling this up, reaching under this cuff and pulling that over the other glove. And I'm going to discard in the biohazard waste bin. I'm going to do hand hygiene. We're going to cover you back up, Patty. And I'm going to educate you just a bit. Are you in a comfortable position? You want me to lift your bed up a little bit? Okay, so you're sitting back up. And we're going to lower your bed down for safety. And I'm going to tell you, if you feel tension on that catheter, or if it feels too much slack, I would like you to use your call light, which I placed next to you, and let us know right away. If you feel any drainage or any discomfort or pain, I need you to call us and let us know. Please don't try to get up by yourself and try to walk by yourself. Just give us a call. We'll have someone come by and go for a walk with you. I'm going to see if you need anything else. You're comfortable. That's great. I'm going to chart the procedure. I'm going to close your door, Patty, and our skill is complete. Thank you.